It's best now to pin back the skin, and in this case the ribs too, so that you can really look at the areas of the pig. You may have to snip a little bit more to really get the flaps all the way down. Lung, lung, heart. I'm actually going to cut down, make another incision so I can peel these ribs back too. Next job is to expose the trachea and the larynx, which is going to be up here, so you need to feel for it. And you want to be careful not to cut too deep. The larynx, I can feel it there. All right, it feels like a little bump. It's a little bit hard. So I'm going to try to clear that by cutting away the tissue with my scalpel. Once you've exposed the trachea, you can feel the larynx right here. It's a big bump. First thing I want you to do is cut above the larynx and see what it looks like inside. Some membranes there you may have to cut so you can lift it up a little bit. All right, and there you can see. Your next job is to cut a little bit below the larynx. We're going to see if we can blow the lungs up a little bit. Use a straw. See if I can blow in there a little bit. You can see them inflate a little bit. The next step is to remove the heart. Here's the heart. You can see the membrane that surrounds it. We need to now cut it out. Here you can see the heart. You can see the aorta. You can see that it's dyed red. This is the aorta. Front. The coronary arteries and veins going diagonally across. Right, and the back. And here you can see a coronary vein. A little bit of a coronary artery there as well. Next job is to take the heart and cut it right across the top. All right. This exposes all the chambers, and this one has a lot of the latex dye in it. Not all the pig's hearts are like this. So I'm going to rinse this and see if we can't get a little better view of the inside. Here you can see now the heart. All right, you can see the different chambers. You can see the thickness in the walls. And you can see some of the blue dye where the deoxygenated blood would be, and the red on this side here when it comes back into the heart. Next step is to cut along the trachea and see if we can find where the trachea branches off into the bronchi. So here are the lungs. You can see the various lobes. And you can see also here where the trachea branches off into the bronchi.